My name is Dr. Jared Blau. I'm a plastic surgeon and I work here at SY Aesthetics. And thank you all for coming. It's great to see everyone here. The purpose of today is to talk about mommy makeover and that sort of procedure. So just to introduce it, I'm excited to talk to you about, without a doubt, the most transformative procedure we have in plastic surgery, which is the mommy makeover. And when we say mommy makeover, we're referring to a combination of surgeries that address some of the changes that women have had from pregnancy. So specifically, we're talking about breast surgery combined with some sort of abdominal surgery. And that combination, whatever combination we decide together, we unite under the term mommy makeover. So if you hear that term, that's what we refer to, breast plus tummy surgery. So many moms come to us with the same kind of situations. After pregnancy, maybe years later, they notice maybe they've got extra skin around their tummy, or like the mom pouch that kind of forms under the belly button and they've got that extra skin that they're feeling. And it may be an area that's sort of not responsive to exercise. You can exercise and try to lose weight, but some stubborn areas persist. It's a very common thing people experience. Usually moms say it was their last child that did it to them. Like they had 3 children, it was the last one that caused the most changes where things kind of didn't snap back the way they used to. And we love moms, and if anyone here is a mom, thank you so much for being a mother. It's wonderful. There are just changes that have happened from the stretching of the belly and from the hormones at the time of pregnancy that cause some changes to people's bodies. The nice thing is a mommy makeover surgery can actually improve those dramatically and get you back on your feet and get you that transformation you're going for. So when we talk about the abdomen, we talk about having stubborn areas of fat or extra skin. And when we talk about the breast, there's a whole range of things. Sometimes women breastfed and they notice that their breasts got larger and they really enjoyed that. However, after the baby is done eating, basically they're done breastfeeding, now the breasts kind of shrink down, they get this like deflation, we call it post-lactation involution, where things get smaller. And so sometimes we want to restore volume to the breast. And we have a lot of ways we can do it. The safest and most common way being a combination of breast implants that we can actually use. And there's so many sizes, so many options. And the implants that we have now are not like what we had 30 years ago if you thought about it. They're actually really safe now. And the 6th generation of implants just was FDA approved about 2 months ago. And we're really excited about all these different factors. They don't rupture like they used to, they feel natural like they used to, and the warranties are great because they cover a lot of the possibilities that can happen with implants, and the company will give you a new set of implants if you ever were to have a problem like rupture, which is really, really helpful. The other thing moms experience is maybe the breasts have gotten softer or droopy, or maybe the nipples are pointing lower than they used to. That can happen from breastfeeding, it can happen from weight changes. And so sometimes we talk about doing a breast lift or a breast reduction at the same time. So maybe you want to perkier breasts, maybe you want some more volume, maybe you want a combination of those. Those can all be achieved. And when you come in for a consult, we'll actually be able to show you what your various options are. So when we talk about combining like breast and tummy surgery, we're talking about doing breast lifts, breast reductions, breast implants. And for the tummy, we talk about doing a tummy tuck, which is a removal of extra skin, and or doing liposuction of the abdomen. So they're both excellent procedures. Tummy tucks have really come a long way in the last 15 years. We don't use drains anymore. We don't have those like plastic drainage tubes coming out. There's a new way that we've learned to do it safely to bring the skin back down to the muscle, where you're not having to empty and deal with like a plastic tube coming out of you. And if you get your tummy tuck here at SY, we're going to include liposuction. There's not an extra charge, it's just part of the technique. So as part of the tummy tuck, we're going to do liposuction of the upper, lower abdomen, the flanks, all the way towards the lower back, every place that we can see while you're lying down. That's all included to give you that beautiful result. The other thing that we do with the tummy tuck that people may not know about is oftentimes moms experience some separation of their abs. We call that diastasis. If you imagine like the 6-pack abs, like 3 and 3 right down the middle, what can happen over time is that as the baby's growing, it can kind of create a space where now those abs have kind of separated, and it creates a little separation in the middle. That contributes to that mom pouch because now there's not that strength there anymore. And a lot of moms also report that their core strength isn't as strong. They're not able to like sit up from a seated position as easily. And that makes sense, because now the muscles which used to be right in the midline to pull you up are now separated. They're pointing in the wrong direction. So at the time of the tummy tuck, we actually restore that back to the midline, strengthen your core, restore that core strength, and get you back on your feet. And diastasis is that separation that, without a doubt, does not get better with exercise. There's a permanent gap that's been created between the muscles. And so a tummy tuck is a nice operation because we get to restore, bring everything back to the midline, and strengthen it. So I'm sort of an evangelist about it. I'm a really big fan of the modern tummy tucks that we do here at SY. We do liposuction at the same time. We do no drains. We repair the muscle, and we remove the extra skin at the same time. So all in one procedure, we can really do a lot of restoration and really reconstruction of the abdomen. And then all the breast procedures that I mentioned as well. Breast lifts, breast reductions, breast implants. So I'm a huge fan of the Mommy Makeover combination. It is by far the thing I do most often in my practice. The breast and abdominal surgeries for women who have had pregnancies and are noticing some of those changes. And so I'm just so happy everyone's here to chat about it. I'm here to answer any questions. We can talk about things like the procedure, how long it takes, recovery, when's a good time to do it, all those things I'm happy to talk about. And if you'll stick around at the end, I'd like to show you our beautiful facilities here actually. So this is a relatively new office. We built the highest grade, highest standard operating rooms you can have in all of cosmetic surgery, and we're fully accredited here. So we do those surgeries here in our beautiful center. I'm happy to show you. All the surgeries we're talking about, you go home the same day. And we've got our own dedicated pre-op recovery. All the nurses here only do cosmetic surgery. Our anesthesiologists only do cosmetic surgery. So we've really created a wonderful team of people, and it's all for this greater SY Aesthetics purpose, which is to try to achieve wellness. And we know that people, if they've got a part of their body that's kind of holding them back, it's not quite feeling the way you want, it's maybe limiting your ability to participate in some activities or just dress the way you want, look the way, feel the way you want, that it's going to affect your overall health. So we're very happy to submit this as part of the overall wellness, and we're very appreciative of moms who have been through a lot and have really done so much for the world to bring children into the world, that now you have a chance to get something that you deserve for you. So again, thanks so much for chatting. If anyone has any questions about it, I'm happy to talk about the different tummy or breast surgeries that we do. Otherwise, we can just talk about any topics that are of interest.